Welcome everyone to Connecticut Community Care's annual meeting. I'm Julia Evans Starr. I'm the president of Connecticut Community Care. And by way of other introductions, I want you to know that we are being joined by our dedicated staff, our engaged board of directors, our committed corporators, our generous donors, our strategic partners, our hardworking providers, valued clients and their families, and cherished friends. So welcome one and all, and thank you so much for joining us today and for your support year-round. So we hope today you'll sit back, you'll relax, maybe you'll have your lunch in front of you, and you'll enjoy the next half hour. So the program flow is going to be that there'll be a few video messages up front, and then we're going to be joined by our guest of honor, Kate McEvoy. We're absolutely delighted she's here with us today at the Bristol offices, which feels like a pretty fancy studio right about now. Meanwhile, throughout the program, we'd love to hear from you. So you'll see on the right side of your screen, there is a chat function. I think it's called Q&A, and I'm going to be scrolling through it throughout the program. So even though we can't be together with one another in person, we really want to participate, feel connected to each other. So please liberally use the chat function. And with that, I want to introduce our outgoing board chair. His name is Michael Quinn. He has given many, many years of dedicated service to Connecticut Community Care, 18 in total.
Hello, everybody. In August of 2020, Julie took over as CEO and president of Connecticut Community Care. And right in the middle of a pandemic, the cases were geometrically increasing, and we were months away from a vaccination program. Julie came in, and with her team, because she didn't do it by herself, did a marvelous job of taking what the resources we had, the challenges we had, and with all the uncertainty again, and worked the entire team through the past year, going through a number of key milestones. As the spring came through, with vaccination rates were coming along at CCC, very closely coordinated with DSS, Julie and her staff. Everybody on the staff did a remarkable job of bringing it together. And there was a lot of touch and go. COVID was still alive and well. Vaccination rates among our clients was at roughly 30 or 40%. So we had a lot of catching up to do there, or the state, all of us had a lot to catch up on there. And basically in the last 4 or 5 months, things have come along very nicely. Again, still with a fair amount of uncertainty. Protocols being changed and updated and keeping up with the changing assessments of where we are and as we recover as a society. Julie and her entire team have done a marvelous job. And I've had the privilege of being the chair of the board for the last year. I'm rotating off, and Beverly Anello will be taking over as chair. So I wanted to extend my kudos on behalf of the entire board to Julie and her team. Thank you.
Thank you, Michael. So Michael's remarks were focused on the pandemic, and rightfully so. It reminds me that at the end of the program, it'll seem like we've wrapped up, but that's not necessarily the case. After we give the closing remarks, there will be a video that features our staff doing their part. Really, it's a call to action, tackling head-on and with raw sincerity vaccine hesitancy. So please stay on at the very end of the program. And fun fact about Michael, maybe some of you who have been connected to Connecticut Community Care, you heard his last name and your ears perked up. Michael is indeed connected to Joan Quinn. He is her nephew. Also, Joan's sons and their family are engaged with Connecticut Community Care still. So service and mission run deep in that family. Now it's my honor to introduce you to Bev Anello. Bev is our incoming chair. She is so remarkably supportive. She just makes people around her better. And she's really embodies the mission of Connecticut Community Care.
Hello, everyone. I am so honored to be the incoming chair of the board at Connecticut Community Care. I look forward to working with Julia and her leadership team as CCC continues to impact so many lives across our state. When I think of Connecticut Community Care, I think of the importance of community. Our staff, our clients, our healthcare providers all share the same goal within the CCC community. It is such a fulfilling endeavor to be part of this wonderful organization. Following a challenging and at times difficult year, let us all move forward and work together so that we succeed in our effort to see you home.
Now, typically at an annual meeting, this would be the point where you reflect on the last year's accomplishments, and trust me, there has been many, and then you look forward to the future with hope and setting your big, audacious goals. As we look back, what can really say about this year? It's been surreal, unrelenting. It has been uniquely challenging. It's altered our world. I don't know what you would say about this year or how it has been for you, but I doubt that 41 years ago, our founder, Joan Quinn, or her early mentees, Molly Reese Gavin, Gail Kataja, I doubt that they could have anticipated such a year. The demands of the pandemic have forced all of us into an environment that is constant change. And now, as we ever so cautiously work our way out of the pandemic, so I hope, we take a deep breath or for me, a long Midwestern pause, which can be off-putting, I know, especially in virtual meetings. But we do so, and we recognize that, we have to dig deep here. We have to dig deep into tapping into our adaptability, our resilience, and our ingenuity. And as we transform and continue the work that we have started, we will realize our big, hairy, audacious goals. Our goals are to advance diversity, equity, inclusion, to embrace value-based care, to forge new and unprecedented partnerships, to maximize our data capacities, to work smarter and continue to leverage technologies and meet the growing and urgent demand for home and community-based services. And we're going to support caregivers in new and meaningful ways. And finally, last but not least, we are going to work toward prioritizing work-life balance for our staff. And throughout it all, we're going to remain grounded, so very grounded in our core impact and collective mission to help people of all ages, abilities, ethnicities, incomes to live their best life at home with support and belonging.
We see people, all ages, all abilities, all unique. We see dignity, courage, and resilience, community, family, love. For 40 years, we've been helping people live independently at home by guiding their care and seeing them through the struggles and possibilities. We're Connecticut Community Care. We see you home.
Okay, best part of the program. At this time, you'll see I've been joined by Kate McEvoy. Kate is our guest of honor. She is now the program officer at the Milbank Memorial Fund. She was formerly, as everyone knows, Connecticut's state Medicaid director. How grateful are we that you are here? It's been so long. I know. Kate, in her true fashion, walked in and she said to us, "How can I be of support to you?" Even though she's the one here being honored. So before we begin, because we want to have a really rich conversation together, we want to take this time to acknowledge you, Kate. On behalf of the residents of the state and Connecticut Community Care, she's been working tirelessly on behalf of, starting with the 1 million or close to 1 million Medicaid members for nearly 10 years. That's incredibly hard to believe.
It is. It just went by very
No. She has been an extraordinary leader and, dare I say, because we're not supposed to call state folks staunch advocates, but you've been a staunch advocate for access and coverage of high quality healthcare for really all people of the state. And we are remarkably grateful for you. Kate also, her reach goes beyond Connecticut. She served as president of the National Association of State Medicaid Directors. And most recently, she was credited singularly for being the driving force to protect older adults and people with disabilities against COVID in our state from our governor. So I could go on and on, but I don't think I need to, and hopefully through the chat function, you're sending your good cheer as well. We have an award for her today. It is Connecticut Community Care's first ever Transformational Leadership Award, and we are giving it to you.
Julie, I'm so humble. Thank you. This is an extraordinary honor. And I just want to say this is reflective of the work of countless folks. I just want to say you and Connecticut Community Care, among many other peers, have enabled that work to which you referred. It is a collective action. So I am very, very proud and thrilled to receive this. Thank you.
Okay, Kate, so as we revel in our gratitude and your presence and all your accomplishments, we wanted to take this opportunity to have a really meaningful conversation with Kate. She is here. We have a series of questions for her, so hopefully you're ready for that.
Sure, absolutely.
I don't know if you want to continue holding that or if that's
put it here.
Okay.
Thank you.
I want you to be comfortable. So we're going to talk about your new venture, but before we do, we want to reflect on your time as state Medicaid director. So can you tell us what has been the most significant changes in that 10-year period for you?
Julie, I think this is a great question to ask. I was struck in Julie's introduction to the degree that she tracked everything that I really would immediately surface as having been very consequential. I think our clinical developments, our move toward value-based purchasing, our embrace of technology, still a work in progress.
Yes.
These are things that Julie and all of you at Connecticut Community Care have really exemplified over time, and also the aspect of never being complacent about further development. This is a continual trajectory all of us are on. That said, I will say, really there are two aspects that have really motivated me in recent years, and one of them may seem a little bit more attenuated for folks who are involved with people with disabilities and older adults, but it is the learning that we have gained around childhood trauma, how it, if left unaddressed, can manifest in a lot of adult onset conditions that may be entirely preventable. So that's a strand that I just urge everyone to keep in mind: childhood trauma and how we could, intervene at an early juncture point with effective supports. Also, you referenced our consciousness of social drivers of health, especially as that manifests in areas of disparity for people of color. Those have been longstanding. They've been starkly illuminated by the pandemic, but I think the consciousness that if folks are not stably housed, they're going hungry, if they don't have food stability, other drivers of environment, if those are not meaningfully addressed at the outset, it's very difficult for people to engage with health goals. So I think that the emerging consciousness and then the applied effort to pay in a different way and to behave in a different way that will help bring that really seems to me to be the most significant part of what we have going forward.
So that 10-year period has really been representative of profound change when you reflect on it.
Really,
right?
yes.
Healthcare is approached and viewed and tackled.
Mm-hmm.
Yeah. Okay, so what major, I don't even know how you answer this, but what major lessons from the pandemic is a takeaway for our healthcare systems?
Yeah, so I just do want to echo something Julie just said about how consequential this year has been on our psyches. I know Connecticut Community Care is very intentional as an employer and, you know, thinking through this and supporting folks. I do want to call that out as just an incredibly real phenomenon as we emerge and even get enough critical and emotional distance to really say what did actually happen in the context of this extraordinarily difficult time. But I do have to say, I feel like there is some important traction that we've gained for which the disability community and all the actors have been moving this work forward for years, really have invested for years. And that is wrapping around the way we do our business in supporting people in human services in ways that can better accommodate them. So telehealth, use of in-home technology as a means of, empowering people in the use of their environment. This is not new for people in LTSS. This is something that we can leap off of and really build. So I feel like the traction that we have overall for insurers, finally embracing some of these strategies that we have long championed is something I feel like we can draw inspiration from. The folks in aging and disability services know how to continue to move this forward, and that is a bellwether for other people in health policy.
So, so you tackled my next question, and that was, I think the perception was we were going to make our way through the pandemic and take off running.
Yes.
And there wouldn't be, so you've talked about trauma, you talked about childhood trauma, and then you talked about the impact of the pandemic. How do we meaningfully discuss it and tackle it and just really acknowledge it?
Yeah, I mean, I think the necessity of that is just becoming very stark.
Yeah.
I will say, I actually believe fundamentally it's about actually building it into our analysis of what has happened. I will just share personally, the Center for Medicare and Medicaid Services did a big analysis of how well it had supported states. They contracted with a nationally recognized organization to do interviews with Medicaid directors, and I had about a 2-hour interview, far-ranging around authorities and emergency assistance and the like. And at the end, they said, "Is there anything else you'd like to share?" And I started to say, I am grateful for the personal support at a time when I felt substantially at wit's end at many, many moments. And I burst out crying. And it was so discomforting for the researchers. That didn't fit in their evaluation agenda. And they were kind of awkward. And it kind of said to me, wow, that should be a conscientious part of actually how we're analyzing what happened and how we leap off that and how we actually address the totality of people's needs. You talked about work-life balance. None of us had any work-life balance, just one element of this. But I think acknowledging the English, especially as we have worked with older adults, all of our grief processes were intercepted, all of the normal channels to, really experience and work through that, haven't been available. So I think both looking at it in evaluation, but then also finding ways to restore those opportunities, it seems to me something we can usefully focus on.
What better way to get your message across to that researcher than?
Yes, it was very compelling, although I think a little bit awkward for them. Yeah, not translatable into.
Okay, right.
Yeah.
Are there any silver linings with the pandemic? Can we find them just yet?
Yeah, well, I think certainly just focusing on home and community-based services, a lot of new recognition in our state survey agency, DPH, about what is occurring in the community, the complexity of the services that are being provided, the strength and enduring stability of these systems. For services that haven't been licensed in the past, DPH really hasn't had a lot of awareness of this. So I think that we've come a long way in terms of them understanding, you know, how we work. And then I think some of these pieces, like I said, telehealth, there's traction there that has overcome some of the doubts and concern around fraud or misappropriation of the use of those tools. Somewhat similar to all the experience we had with use of personal care assistants over the years. I think we've really gotten to a point where we can really say the evidence supports those interventions.
That's great. Okay, so in your role as National Association of Medicaid Directors, as the president of that, would you say Connecticut is unique?
I certainly would.
Okay.
Yeah, no, I would. And I would say that is evidenced by a number of different things. Notably, however, the relationships people here. When we look at a long-term services and supports continuum, it is incredibly rare across the country for there to be the applied partnerships, especially across all the facets of the continuum. The fact that, you know, Julie, your relationships or long-standing relationships with both of the nursing home associations, there's a sense of collective effort around rebalancing as it is a systems change effort. As opposed to each sector really looking at this in its own particular application. And that does not exist elsewhere. So I think that piece is what I really focus on as like an exemplary part of our environment.
That's good to know. Okay, Milbank Memorial Fund. Tell us about it.
So Milbank is an over 100-year-old family foundation that was first established by a woman philanthropist, interestingly, who inherited money and invested it in one of the first ever foundations around public health in New York City. Originally, it was around issues that are very dear to women at the time, sanitation, water safety, and the like. But Milbank has evolved over time to focus on applied healthcare policy and also state leadership. Milbank has been known for many years and being a convener for folks from executive branches and legislators across the country, trying to strive for bipartisan civil solutions that kind of transcend the often rancorous, you know, polarization that we have. So it's a very interesting organization. It just focuses on a lot on dialogue and connection.
Congratulations to you. And you're going to be focusing on aging?
I am. This is one of the main reasons why I was so taken with the idea of working at Milbank, is because they are essentially committing afresh to aging health policy. And so there's a lot of room to kind of explore where to focus. Originally, you know, the thought is to look particularly at issues related to direct care workforce, also to supportive housing, but really the sky's the limit, and I'm going to be talking a lot to people like you, Julie, that kind of help set an agenda for what we can do to connect people.
That's great. Okay, so I know I'm getting the high sign here. The half hour went very quickly, and now I wish we'd made it a little longer. So I am going to do my bit, because I thought this would be kind of interesting to do rapid fire questions. So if you're up to it, Kate, I have some questions for you. Okay, we're going to go fast.
Yep.
Your favorite podcast?
I don't listen to no podcasts. I'm such an embarrassing Luddite. I know I'm like the only person in the known world. Yes, exactly.
The last book you read?
Health Cat by Michael Marmot. Great book on social determinants.
Good tip. A concert or show you'll never forget?
Seeing Green Day, a favorite punk band of mine. It's surprising that I'm a fan of punk music, I'm sure.
Somewhat, but name an ageist accepted practice you'd like to change.
I hate that people assume that as people age, they lose decisional capacity. Drives me crazy.
Caregivers are
the lifeblood of our entire LTSS system.
A practice you use for self-care during stressful times?
Running, and meditation.
I thought you were going to say baking.
Well, baking is also very good, but that requires running. Yeah.
What one thing makes you most proud?
My relationships, you know, that I just go back to say that's a precious thing about Connecticut, is that we all know one another. We're a small state. We have that opportunity. So yes, relationships.
a necessary skill or trait for daring leaders?
Having a story and translating it in different settings for different types of stakeholders. You're responsible for telling your own story.
Perfect. And any advice or hope for the CCC family?
I'm very motivated by a saying, we rise by lifting others. And I feel like the work that Connecticut Community Care is all about that. We derive such a lot from working with people who are looking to, be self-directing and empowered in the community, and it's of reciprocal benefit. So I always think of that as something that is a good call to action for me.
That's perfect. Okay, so we want to thank the extraordinarily gifted Kate McEvoy for joining us today. We're honored to honor you with the Transformational Leadership Award. We're excited to hear what happens with your new job.
We will be in touch.
Okay, and kudos to our dedicated board, our corporators, our partners, our donors, the providers, and everyone who supports our mission, especially during this challenging time. And, we're going to look forward from what we've learned these last 19 months and guidance from experts. We're really going to move forward with great enthusiasm and determination. And to our staff, we hear you, we see you, we're with you, and we sincerely appreciate you. And to our clients, finally, to the clients of today and tomorrow, we want you to know that you can trust that we'll see you home.
My personal experience through COVID and getting the vaccination was intense. Unfortunately, with social media and the misinformation that was out there, my mind went all over the place.
Being African American and being untrusting of the medical field, doctors, nurses, so I was uncomfortable.
I don't like needles. I absolutely am not a fan of those. And then also the system, trying to navigate that was a little bit of a concern for me.
I was scared to get the vaccine myself because of my health concerns. On June 11th of 2020, I was positive of COVID. And on June 14th of 2020, I was hospitalized with COVID. COVID almost took my life away. And it was very scary.
One of my main reasons that I decided to get vaccinated because I have grandkids.
My husband does have asthma, which is pretty severe at times, and I have a 4-year-old daughter.
My dad, who is a 10-year cancer survivor, really pressed upon me because I was concerned about transmitting anything to him.
I have to do my own research by looking at the CDC website, state resources, as well as physician blogs. I was really able to come up with the ultimate decision of protecting myself now and also in the future.
I personally decided to take it because I didn't want to be in the hospital for another 18 days. I didn't want to be behind those 4 walls and not being able to talk to my son.
I definitely had a sense of responsibility for all of the clients that we serve here at Connecticut Community Care.
As a case manager and wanting to be able to see those individuals again, I did feel a sense of responsibility to be vaccinated.
We are responsible in the MFP program to go into the nursing facilities and go into people's homes. And again, I would not want to be the person to transmit it to anyone and cause them to be sick. Having been vaccinated, I feel comfortable enough to go around family, enough to go around friends, and realizing that it's not about me per se, but it's about others.
Seeing more people in person was the one thing that really has been the best part about being vaccinated.
My mental health has drastically improved. I'm able to now associate with family and friends safely. I'm also able to see my elderly grandmother who has Alzheimer's.
Now that I've been vaccinated, I feel a little bit safer, I'm more relaxed going out. I'm still keeping my distance and my mask, and I feel fine. It's like I contributed to the world, and I'm happy.
If I can give someone my own personal advice regarding getting the vaccine or not, I would tell them to do their own personal research. Unfortunately, social media is not the answer for all.
Talk to physicians you're comfortable with, nurses you're comfortable with, as I myself did research before I became comfortable.
Even if you are feeling somewhat unsure, doing that little part gets us so much closer to being back to where our relationships can be better.
I fought COVID. I am a survivor from COVID, and I don't want to see anyone, even my worst enemy, go through what I went through with COVID.
We at Connecticut Community Care are in full support of the state of Connecticut's efforts to get all of its residents vaccinated. We do so as a partner. We're rolling up our sleeves because we know the vaccine is safe, it's effective, it's free, and it's now available for all.